Skeletal system. Skeletal system. Bones and joints form the skeletal system of the body. The functions of the skeletal system are: 1. Support and protection of soft tissues and vital organs. 2. To give attachment to muscles. 3. Formation of red blood corpuscles in the bone marrow. 4. Storage of mineral salts like phosphorus and calcium. Classification of bones. Bones of the skeleton are classified as: 1. Long bones. They are found in the limbs. A long bone contains a shaft and two extremities. The long bones act as levers and help in various body movements. 2. Short bones. These have no shaft, but they contain a spongy substance covered by a shell of compact bone. Example: small bones of the wrist and ankle. 3. Flat bones. They contain two layers of compact bone with a spongy substance in between. Example: pelvic bones and scapula. 4. Irregular bones. They do not fall into any category. Example: vertebrae and bones of the face. 5. Sesamoid bones. These are small bones that develop in the tendons of muscles. Example: the patella of the knee joint. Structure of bone. Bone is the hardest of the connective tissues. It consists of two kinds of connective tissues. 1. Compact bone. 2. Cancellous bone. Compact bone. It is hard and dense. It is found in flat bones, in the shafts of long bones, and as a thin covering of all bones. Cancellous bone. It is spongy in appearance. It is found in the ends of long bones, in short bones, and in between two layers of compact tissue of flat bones. Bones of human skeleton. A total of 206 bones form the human skeleton. These bones can be classified as: 1. Bones of the skull, bones of the cranium, face and lower jaw. 2. Bones of the trunk, ribs, sternum, vertebral column. 3. Bones of the upper limb, scapula, shoulder girdle, humerus, arm bone, radius and ulnar, forearm bones, phalanges, finger bones. 4. Bones of the lower limb, pelvic girdle, hip bone, femur, thigh bone, tibia and fibula, leg bones, metatarsal bones, foot bones. Bones of the skull and trunk form the axial skeleton. Bones of the upper and lower limbs form the appendicular skeleton. Bones of the skull. The bones of the skull are divided into two groups. 1. Bones of the cranium or brain box. 2. Bones of face. Bones of cranium. Cranium is formed by 8 bones. They are: 1. One frontal bone. 2. Two parietal bones. 3. Two temporal bones. 4. One occipital bone. 5. One sphenoid bone. 6. One ethmoid bone. Frontal bone. It forms the forehead and the roof of the orbit. The features of the frontal bone are: supraorbital margins form the arches of the orbit. Nasal notch bone projecting between supraorbital margins. Nasal bones are fitted to this. Superciliary arch lies above these two structures. Frontal tuberosities, the two prominences of the forehead. Frontal sinus, a space behind the forehead. It contains air and is lined by mucous membranes. Parietal bones, they are 2 in number. Both form the roof and sides of the skull. It has 4 borders, 4 angles and 2 surfaces. The articulation of this bone is: anteriorly with the frontal bone, posteriorly with the occipital bone, medially with the other parietal bone, below with the temporal bone. Temporal bones, they are 2 in number. They form the lower part of the sides of the skull. 1. Squamous part, a flat part having the zygomatic process which is connected to zygomatic bone. 2. The petrous part, forms the bone of the internal ear. 3. Mastoid part, contains mastoid process. 4. Tympanic part contains the external auditory meatus. Sphenoid bone, it lies at the base of the skull. It forms a large part of the middle cranial fossa. Ethmoid bone, it is cubical. It is very light and thin. It is situated at the roof of the nose and in between the orbits. Cranial fossae, the base of the skull is divided into 3 fossae. Sinuses of the skull, these are cavities or chambers present in the bones of the skull. The important sinuses are: frontal sinus, they are 2 in number present in the frontal bones. They are present on each side at the root of the nose. Maxillary sinuses, 2 in number present in the maxillary bones. They lie on each side of the nose. Ethmoidal and sphenoidal sinuses, they are the other sinuses present in the skull. All these sinuses communicate with the nose. Functions of sinuses. 1. They give resonance to the voice. 2. They lighten the bones of the face and cranium. Bones of the face, the bones that make the face are 14 in number. These bones are 1. 2 maxillae, upper jaw. 2. 1 mandible, lower jaw. 3. 2 palate bones. 4. 2 zygomatic bones. 5. 2 lacrimal bones. 6. 2 nasal bones. 7. 2 inferior turbinate bones. 8. 1 warmer bones of upper limb, scapula. It lies at the back of the thorax. It forms the posterior part of the shoulder girdle. It has 2 surfaces, 3 angles and 3 borders. The surfaces of the scapula are anterior or costal surface. It is called as the suprascapular fossa. It lies nearest to the ribs. The subscapularis muscle is attached to this surface. Posterior or dorsal surface. It is divided into 2 fossae by the spine of the scapula, which ends with the acromion process. The fossae are 1. Supraspinous fossa, which is the upper one. It gives attachment to the supraspinatus muscle. 2. Infraspinous fossa, which is below. It gives attachment to the infraspinatus muscle. The borders of the scapula are superior border. It lies in the upper part. It extends from the superior angle to the base of the coronoid process. The suprascapular notch is at the inner extremity of this border. The suprascapular vessels pass through this notch. Medial or vertebral border. It is nearest to the vertebral column. It extends between superior and inferior angles. Lateral or axillary border. It is nearest to the axilla. It lies between the inferior angle and the glenoid cavity. The angles of the scapula are superior angle. It lies at the junction between the superior and medial borders. Inferior angle. It is the junction between medial and lateral borders. It is the lowest point of the scapula. Lateral or external angle. It contains a glenoid cavity that receives the head of the humerus to form the shoulder joint. The coronoid process of the scapula arises internal to the glenoid cavity. Clavicle. It is also called a collarbone. It is a long and curved bone. It forms the anterior part of the shoulder girdle. It contains a shaft, 2 ends and 4 borders. The ends are the medial or sternal end. It articulates with the sternum. Lateral or acromial end. It articulates with the acromion process of the scapula. The borders of the clavicle are superior, inferior, anterior and posterior borders. Humerus. It is the longest bone of the upper limb. It contains 2 extremities and a shaft. Upper extremity. It contains a hemispherical head that articulates with the glenoid cavity of the scapula at the shoulder joint. Anatomical neck, which is below the head. Lesser tuberosity, which is also below the anatomical neck, but it is at the front. Shaft. It contains deltoid tuberosity is a rough tubercle on the lateral aspect of the shaft. It receives the insertion of the deltoid muscle. Spiral or radial groove, which is an oblique groove across the back of the shaft. The radial nerve passes through this groove. Lower extremity. It contains trochlea, which is a pulley-shaped surface on the inner side. It articulates with the ulna. Capitulum on the outer side. It articulates with radius. Coronoid fossa, which is a depression. It lies above the articulating surface of the ulna. Medial and lateral epicondyles lie on each side of the articulating surfaces. Ulna. It is the innermost bone of the forearm. It contains 2 extremities and a shaft. Upper extremity. It contains coronoid process, which is a projection in front. It fits into the coronoid fossa of the humerus. Olecranon process, which is an upward projection at the back. It fits into the olecranon process of the humerus. Trochlear notch, which is formed by these 2 processes. It articulates with the trochlear surface of the humerus. Radial notch, which is on the outer or lateral aspect. It articulates with the head of the radius. Radius. It is the lateral or outermost bone of the forearm. It contains 2 extremities and a shaft. Upper extremity. It contains 1. A head that is more or less button-shaped. 2. Neck, which lies below the head. 3. Biceps tubercle, radial tuberosity, which lies below and to the medial side of the neck. It gives insertion to the biceps muscle. Bones of wrist and hand. Bones of wrist. The bones of the carpus or wrist are arranged in two rows. They are: the first or proximal row is made of scaphoid, lunate, triquetral and pisiform bones. Second are distal row made of trapezium, trapezoid, capitate and hamate bones. Bones of palm. They are made of metacarpal bones. They are long bones that contain a head, a shaft and a base. The bases articulate with the distal row of carpal bones. The heads articulate with the proximal row of phalanges. Bones of fingers. They are made of phalanges bones. These are long bones. The thumb has 2 phalanges. Other fingers have 3 phalanges. They are proximal, middle and distal phalanges. Metacarpophalangeal joints are the joints between the metacarpal and phalangeal bones. Interphalangeal joints are the joints between the phalangeal bones themselves. Bones of thorax. The skeleton of the thorax is made of the following bones. 1. Sternum in the front. 2. 12 pairs of ribs at the sides. 3. 12 thoracic vertebrae at the back. Sternum. It is also called as breastbone. It is a flat bone which is divided into 3 parts, namely manubrium sterni, body of sternum and xiphoid bone. Manubrium sterni. It is the upper part which is triangular. It contains 1. Clavicular notches on both sides. These notches articulate with clavicle. 2. Suprasternal notch which is present in between the 2 clavicular notches. 3. Articular surfaces on both sides for the first rib. Body of sternum, gladiolus. The second rib is attached sternum. This junction is called as angle of Ludwig. The junction between manubrium sterni and the body of sternum has attachments for the 3rd, 4th, 5th, 6th and 7th ribs. Xiphoid bone, ensiform process. It is the lowest part of sternum. To this are attached the diaphragm, linear alba and rectus abdominis muscle. Ribs. They are arranged in 12 pairs, on the back side. All of them are attached to thoracic vertebrae. Depending on their attachment in the front, they are classified as 1. True ribs, which are the upper 7 pairs. They are attached to the sternum directly. 2. False ribs, which are the lower 5 pairs. They are attached to the sternum indirectly, through costal cartilage. 3. Floating ribs are the lowest 2 pairs. They are not attached in front. Vertebral column. The vertebral column, or spinal column, is made of several bones. These bones are called vertebrae. In all, there are 33 vertebrae. Classification of vertebrae. According to the region they occupy, the vertebrae are classified as 1. Cervical vertebrae, 7 in number. They form the neck region. 2. Thoracic vertebrae, 12 in number. They form the back of the thorax. 3. Lumbar vertebrae, 5 in number. They form the lumbar region. 4. Sacral vertebrae, 5 in number. They form the sacrum. 5. Coccygeal vertebrae, 4 in number. They form coccyx. Cervical vertebrae, they are 7 in number. The first cervical vertebra is called as atlas. The second cervical vertebra is called as axis. These 2 cervical vertebrae have different structures when compared with others. Atlas. It is the first cervical vertebra. It does not have a body. It does not have a spinous process. On the upper surface, it has 2 facets. These facets articulate with the condyles of the occipital bone, to form an atlant occipital joint. Axis. It is the second cervical vertebra. It contains 1. An odontoid process is an upward projection from the body. It articulates with the anterior arch of the atlas. 2. 2 facets on the anterior surface. They articulate with an atlas. 3. A spine which is small and bifid. Thoracic vertebrae, they are 12 in number. These vertebrae carry the ribs. The characteristic features of these vertebrae are: 1. The body is heart-shaped. 2. The body has facets, one on each side for the attachment of the head of the ribs. 3. The transverse process has facets at the tips for articulation with the tubercle of ribs. 4. Vertebral foramen is absent. 5. Pedicle and laminae are absent. 6. The spinous process is long and projects downwards. Lumbar vertebrae, they are 5 in number. They have the following characteristics. 1. The body is big and kidney-shaped. 2. The spinous process is short, stout and directed backwards. 3. No articular facets for ribs. 4. Pedicles and laminae are present. Sacral vertebrae, they are 5 in number. All of them unite to form a single bone called the sacrum. The sacrum joins with the pelvic bone and takes part in the formation of the pelvic cavity. The features of the sacrum are: 1. Sacral foraminae, which are 4 openings present in the anterior surface. Nerves pass through these openings. 2. Lateral masses on either side. They are formed by the union of transverse processes. 3. Sacral promontory, which is the projection of the upper part of the sacrum. Coccygeal vertebrae, they are 4 in number. All of them unite to form a single bone called coccyx. Ligaments, the vertebrae are held together by the following ligaments. 1. Anterior and posterior ligaments, they run the whole length of the spine. They connect the anterior and posterior aspects of the bodies respectively. 2. Ligamenta flava, they connect the laminae of vertebral arches. 3. Supraspinous ligaments, they lie between the spines and connect them. 4. Intervertebral discs, they are made of fibrocartilage. Bones of lower limb femur, it is also called as thigh bone. It is the longest and strongest bone of the skeleton. It contains 2 extremities and a shaft. Shaft, it is smooth, cylindrical and rounded in front and the sides. Lower extremity, it contains medial and lateral condyles lying one on each side. Patella, it is a sesamoid bone developed in the tendon of the quadriceps femoris muscle. It contains 1. An apex pointing downwards. The ligamentum patellae is attached to the apex. 2. An anterior surface that is rough and covered with a bursa. 3. Smooth posterior surface. It articulates with the patellar surface of the femur to form the knee joint. Tibia, it is the innermost bone of the leg. It is a long bone containing 2 extremities and a shaft. Upper extremity, it contains, a head contains 2 condyles, namely medial condyle and lateral condyle. The upper surfaces of these condyles articulate with the corresponding condyles of the femur. The popliteal notch separates the 2 condyles at the back. Tubercle of the tibia, which lies below the condyles in the front. Lower extremity, it is slightly expanded. It has an articular surface for talus to form the ankle joint. Medial malleolus is a downward projection present in the medial aspect. Fibula, it is the lateral or outermost bone of the leg. It is a long and slender bone. It contains 2 extremities and a shaft. Upper extremity, it contains, a head that is expanded. It articulates with the back of the lateral condyle of the tibia. It does not take part in the formation of knee joints. The styloid process is present in the apex of the head. One ligament of the knee joint is attached to this shaft. It is thin and gives attachment to several muscles lower extremity. It contains lateral malleolus, which is a downward prolongation of the lower extremity. Malleola fossa, which is a rough depression behind the malleolus. Bones of the foot can be classified as tarsal bones, 7 bones, metatarsal bones, 5 bones, phalangeal bones, 14 bones, tarsal bones. They include calcaneum, talus, navicula, cuboid and 3 cuneiform bones. Calcaneum, it is the largest bone of the foot. It lies at the back of the foot. Above, it articulates with the talus and in front with the cuboid. The calcaneum gives attachment to the tendon calcaneus of a calf muscle. Talus, it forms the central and highest point of the foot. It articulates at the sides with medial and lateral malleoli and below with calcaneum. Navicula, or scaphoid, it is a disc-shaped bone. It is present in the medial aspect of the foot. It lies between the talus at the back and 3 cuneiform bones in front. Cuboid, it is in the lateral aspect of the foot. Behind, it articulates with calcaneum. In front, it articulates with 2 lateral metatarsal bones. Cuneiform bones, they are 3 in number, namely medial, intermediate and lateral cuneiform bones. Posteriorly they articulate with navicular bone. Anteriorly they articulate with 3 metatarsal bones. Metatarsal bones, they are 5 in number. They correspond with the 5 toes. All of them are long bones. 1. They contain a head, shaft and base. 2. The first metatarsal is thick and stout. 3. The second metatarsal is longer than the others. 4. The fifth one has a projection at the lateral side of the base. Phalanges, there are 14 bones, 2 for the first toe and 3 for the rest. All of them are long bones. Arches of foot, in the foot, the bones are so arranged that there are 4 different arches. There are 2 longitudinal arches and 2 transverse arches. These arches are a medial or internal longitudinal arch. For this, 1. Posterior support is given by calcaneum. 2. Anterior support is given by the navicula, 3 cuneiforms and heads of 3 inner metatarsal bones. 3. Summit is provided by the talus. B. Lateral or outer longitudinal arch, this is formed by calcaneum, cuboid and 2 outer metatarsal bones. C. Transverse tarsal arch, it is formed by the tarsal bones. D. Transverse metatarsal arch, it is formed by the heads of metatarsal bones.